I am joined now by Emily Griese, who is Vice President of Operations and Population Health at Sanford Health Plan. Emily, welcome.
Thanks, Courtney. Great to be here.
Glad to have you. Now, you just finished a panel talk on ways we can break down barriers through virtual solutions. Tell me, what are we finding are the best ways to meet members' needs?
Yeah, it's a great question, Courtney. And it was fun to kind of hear the panel and where everybody's at in their journey for meeting members' needs. I mean, we all recognize that we've got what I'll call Amazon savvy members, which is just like me. I expect everything to be easy. I expect kind of that one click to get where I need to, and I think that's what we're facing as a health insurance company and as a payer connected with a provider. How do we make it feel seamless for them as they're working kind of through seeing a provider and working with us as kind of the payer side? I think we've got huge opportunities around just general member engagement and meeting members where they're at, and it looks different for each member. Some members want that digital interface and want virtual visits, and others want in-person care and want care coordination with someone right beside them. And so I think from our perspective, it's figuring out how to personalize and make sure that we really meet the member where they need us to.
Wonderful. And you talked a little bit, Emily, about virtual care wellness visits and screenings for high-risk members to improve outcomes. How is this translating to better care?
Yeah, so we've been really proud of some of the work we've gotten to do over the last 6 months or so in coordination with our healthcare system with Sanford. We were able to stand up kind of a virtual preventive care clinic where we had some of our highest risk members come into us through virtual means. And I think that's unique in that those members may not have ever sought care. We actually targeted those individuals who were not seeing any provider. They didn't have that connection with the healthcare system, and we targeted them through a virtual preventive visit. And we actually found we had over 1,000 members who came to us that way. And then what I would say in terms of translating it into meaningful outcomes, what we found was that those members who came and did those virtual visits, about 50% of them were referred into the Sanford system in some way, shape, or form to see a specialist or to get that continuity of care that they needed and that they wouldn't have had if we wouldn't have gotten them in through that virtual visit. So very proud of the work that the team did and excited about the kind of the high quality care that those members are now receiving.
Great to hear. And lastly, we're seeing huge investments in virtual behavioral health. Sanford Health is among those health systems covering virtual behavioral visits. Emily, can you talk more about the acceleration in behavioral health integration through telehealth?
Behavioral health is one of the biggest kind of things facing us as a healthcare industry. And we recognize that our members need behavioral health services. And our job kind of on the payer side is to make sure that we break down barriers to access. The provider side is certainly working diligently, and it's been fun to partner with them as they bring on more behavioral health providers, as they continue to stand up different avenues for members to receive behavioral health and care. But from a payer perspective, it's our coordination. It's our ability to make sure that they know that access is there, and then that we're breaking down barriers in terms of payment and everything else. So we're making it easy for them to get the care that they need. I think about behavioral health and kind of the telehealth strategy as being either something that people do for convenience or do because it's critical. And I would say when it comes to behavioral health, the need for virtual care to get to everybody as they need it is critical at this point. And so I think there's certainly just kind of an acceleration for us to make sure that we're providing those services and we break down the barriers.
Emily Griese joining us in Chicago from the Becker's annual meeting, Vice President of Operations and Population Health at Sanford Health Plan. Emily, thank you so much for your insight and your time this afternoon.
Thanks so much, Courtney.
For Sanford Health News, I'm Courtney Collin.